Hello, my name is Kylie and I'm a technician here at Cat Care, and today we're going to be going over how to give subcutaneous fluids at home. So first of all, I always recommend doing it during a quiet time or peaceful time during the day, whether that be in the morning or at evening. I always recommend making sure you're getting all your things prepared before you even start. So you'll be going home with a set of fluids, which will be in a bag like this. You'll also be going home with an IV set, drip set, which will be individually wrapped. You'll be going home with a set of needles. Then will vary in depending on size, whatever works best for your cat. We usually typically will send home an 18 gauge first, just to see how their first rounds of fluids go. And I usually recommend using like either a paper towel or a gauze, just for the end. So I'll show you how to set everything up together. So you'll have to open up your bag. Following opening up your bag, you should always look for any signs of leaking. So gently just squeeze in the bag, you're looking for any signs of leaking in the bag. And then you'll find that they'll have two end caps here, and you want them to be on, and they should be completely on there. As for getting your drip set, you notice that it comes with a couple different types of clamps. One of the things I wanted to go over as well is that depending on where you get your fluids from, they might look a little differently. So as you can see with this one, it's got a little different injection port. This one is just like you would with the green ones, you would just completely pull this off. Again, you want to make sure that you're minimizing any type of contamination when you're inserting your spike for your drip set. As for this type is the one that you with LRS, and they have two. You only need to use one. And the way you untake this one is you gently pull off the green cover, like so. That's also, again, making sure that you're minimizing any type of contamination prior to using your spike for your drip set. And that is the two different types of probably ports that you will see for LRS fluids. Just wanted to go over the two different types of clamps that are on your drip set. So this is a C clamp. Right now it is closed, and now it is unlocked. And this is to lock it. It's just a gentle squeeze. The other type of locking mechanism is a roll clamp, as you can see here. All you have to do is you gently roll it up, and now it is open. To close it, you just gently roll your thumb down, and now it is in the locked position. Now the fluids, being with both locked, will not be flowing through the line. To give fluids, you need to make sure that both locks are unlocked prior to giving administrating fluids. For when it coming to puncturing the bag, you want to have it a little bit over the edge so that the ports are completely full. You want to take off the cap. Make sure that you're avoiding contamination of this port. You want to make sure it's clean. Then with that, you usually will take off your end of your puncture. So with taking that, you may want to make sure you poke into the bag firmly. Sometimes you'll have to use a little good firm pressure. And prior to inverting the bag, I recommend you closing your clamps. When you go to invert it at home, I recommend usually using a hanger. And then you'll probably be able to hang it up on a door or doorknob and like such. But today we'll be using an IV pole. So to get the IV line primed, you'll have to unlock your locks. So the C-clamp, again, is locked right now, and I'm unlocking it. I'll have to undo both so I can prime the line. And as you can see, the fluid is running right now. And we want to make sure all of the air is out of the line. Again, now I'm locking this and locking your C-clamp, making sure that all the air is now fully out of the line. We do not want to administer any air into the cat. So that is properly prepared for that. And once you want to put on your needle, you want to take off the cap. Again, making sure that you're avoiding any type of contamination once taking the cap off. And you just, with a firm twist, and now the needle is locked in position to where you need. Now I usually recommend finding a nice comfortable place for your cat. Whether that's in a bed or on a blanket, somewhere nice and quiet so that you can give the administration fluids. And now we're going to go get our kitty. Helping me with this demonstration today is going to be Cheeto. She's going to show us how to give fluids at home. So once you get everything set up and your cat is in a comfortable position, whether it be on their bed or on a nice comfortable blanket, I wanted to make sure that you know how much to give. Sometimes it'll vary depending on how much your doctor wants you to give at home, whether it be once a day or twice a week, or how much in total in volume. So just to show you on the bag too, is that this is currently at 1,000 milliliters. Most cats will get anywhere from 50 to 100 to maybe 150. So just so you know that this is currently, if we were going to give her 50, it would go down to this dotted line here. If we're going to 100, it would go down to the 1. So that would be 100 milliliters. So when it comes to getting the cat used to getting poked, what I usually recommend is when you get home, like not when you're even thinking about it, I usually will just be tenting the skin. Usually the fluids will all go into this area that's behind the shoulder blades. I recommend going there because that's where usually the most skin is available and allows them to hold the most fluids. As you can see, I'm like tenting the skin here. And I recommend doing this for all hours of the day. So just so your cat gets used to and comfortable with you doing this tenting of the skin. And as you can see, I'm also taking my needle and poking right here. So what I'm doing here is like I'm making the tent and I'm pretending with my finger that this is going to be a needle. So just so that you're not only when you're going to do this, that your cat doesn't automatically think that when you go to do this, this is when they're going to be getting fluids. So it helps to habituate them and get more comfortable with that movement. So with that being said, I'm going to go and give her fluids. Again, sometimes having an assistant is always helpful. And if you find that your cat is very food motivated, it actually really helps with fluid administration. Depending on what dominant hand you are, I'm right hand dominant, so usually I'll be recommending giving it in your right hand with your needle. So, but whatever works best for you at home. So with the bevel up, which the bevel is where the angled part of the needle is, you want that up. So as like I'm saying, you're doing the tenting, and I'm using my finger to go for the spot where I'm going to be puncturing the needle. You do a quick poke, and I'm just going to hold it here while she's doing that. As I'm doing that, I'm taking my hand, and I'm releasing the C-clamp, and I'm also releasing the rolling lock. As during this time, you're going to watch for how fast it's flowing. The different variations of why it would flow differently would depend on the size of needle that you're using and the elevation. Usually having it at a higher elevation will help speed things along. Also, you might find that if you give a gentle squeeze of the bag, will help with speeding up the fluid administration. So you do whatever's comfortable. Sometimes also redirecting your needle may also be needed to change the flow of the needle. So as now she's gotten about 50 milliliters of fluids, we're going to clamp off our clamps. So clamping and locking the C-clamp and the rolling lock. And then you're going to gently pull out, and I'm going to just cover it with my thumb as I'm pulling out. When you go to recap, you don't want to use multiple fingers. So as you can see here, I'm just going to use the surface to puncture and make sure that cap is on. You might use a gauze or a paper towel to cover over the hole, just so that it minimizes any type of leaking. You might see a little pink tinge that is completely normal. As you can see that there might be a little bit of a hunchback or camel hat, as you can see in a little cheesy poof. That is completely normal. And sometimes throughout the day, the fluid hump might go down into one leg or another. That is completely normal and to be expected. And depending on your cat, sometimes it'll take up to like a full 24 hours for the fluids to be fully absorbed. So don't be surprised if you see it lingering in that leg or in those shoulders. And that is the conclusion of how to give sub-Q fluids at home.